I've been able to get no assurances from CMS that they care one whit about this payment differential, or that they see ahead as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved.
Rhode Island is facing a healthcare crisis that's been overlooked for far too long. Senator Sheldon Whitehouse takes aim at CMS for policies that leave Rhode Island hospitals and doctors underpaid compared to their neighbors in Massachusetts and Connecticut. The senator doesn't just highlight numbers, he paints a stark picture of a healthcare system bleeding out while bureaucrats fail to fix glaring inequities. Today, we break down his fiery remarks, the urgent call for fairness in healthcare payments, and his push to transform end-of-life care for families in Rhode Island.
Mr. Secretary, I want to talk to you about Rhode Island. When you were last sitting there, here's what I said to you. I want to read it back to you because I want it to sink in. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers, a difference of 23 and 26% in our regional healthcare market. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid. And the one act that CMS took on this issue years ago was to make it worse. I raised that with you then. I've raised it since with Dr. Oz. I've raised it with CMMI Director Sutton. I would like to get action from CMS on that. One partial avenue of relief for Rhode Island is the AHEAD program. Rhode Island is a willing voluntary participant in the AHEAD program. Coming behind Rhode Island is Connecticut. What remains to be seen is whether the payment rates agreed to for Rhode Island will suffer the same discriminatory discount with respect to the AHEAD rates for Connecticut as Connecticut comes through. I've been able to get no assurances from CMS that they care one whit about this payment differential, or that they see ahead as a means of resolving this injustice. Mr. Kennedy, our healthcare system is teetering as a result of this. This is not a casual matter, and I would really like to see you and Dr. Oz and Mr. Dutton put your attention onto this Rhode Island problem. There is no conceivable justification for paying a hospital in Fall River 23% more than Rhode Island Hospital when Rhode Island Hospital provides more and better services, as recognized by the Secret Service, which will take an injured president from Martha's Vineyard to the Rhode Island Hospital Trauma Center, flying right over St. Anne's Hospital in Fall River, yet Fall River gets paid more. It makes no sense, and it has to be resolved. The other problem that I mentioned to you is that I'm now in my 4th round of CMMI directors. It's bloody Groundhog Day, trying to get something done about how end-of-life patients are treated. I'm offering Rhode Island as a willing example of how we can do it better. It is idiotic and cruel to force a family to put their dying loved one through 3 days and 2 nights of a hospital before they can put them in a nursing home. It is equally ridiculous to not allow palliative and curative care to happen together. Providing home care when someone is dying, even if they can still get out of the house or into the yard, is a basic thing to ask. And to have respite care be that somebody comes to the house instead of taking a dying family member to a hospital, that's not even respite. Every single one, Mr. Kennedy, of these waivers has been granted in the past by CMMS and other circumstances. All I want is for somebody to come and work out how we do this in Rhode Island. What is our patient base that we'll do this in, how we put the waivers together. To quote your CMS director, Mr. Oz, he said, "As we discussed in your office, we must re-examine how end-of-life care is addressed in this country. I'm offering Rhode Island as an example of how to make it better. I hope you will concede that right now it is not good." So
Senator,
I
everything
need
you
you to respond to me. You guys know where to find me. I'm up in the Hart Building.
yeah.
Reached out, we've tried for meetings, and the progress in all three of those areas, fixing the payment gap, getting ahead balanced regionally, and following through on our desire to do good things, improving end-of-life care with waivers you guys have already granted, has gotten me so far no place. And forgive my impatience, a lot of it predates you. I put a hold on Biden nominees because I was getting jerked around by your bureaucracy. I'd like it to end and get some progress.
Senator Sheldon Whitehouse delivered a forceful critique of the Centers for Medicare and Medicaid Services, CMS, highlighting what he calls a long-standing injustice facing Rhode Island's healthcare system. His central argument is simple but alarming. Rhode Island hospitals and doctors are being reimbursed significantly less than their counterparts in neighboring states, even though they deliver equally high, if not better, levels of care. According to Whitehouse, providers in Rhode Island receive 23% less than those in Massachusetts and 26% less than those in Connecticut, creating a disparity that threatens the survival of the state's healthcare system. The senator underscored how absurd this situation has become by pointing out that the Secret Service, when faced with a presidential emergency, bypassed hospitals in Massachusetts and took the injured president directly to Rhode Island's trauma center, acknowledging its superior capacity. If Rhode Island's healthcare facilities are trusted at the highest levels of government, Whitehouse argued, then they certainly deserve fair payment rates. Yet CMS has not only failed to correct the inequity, its past actions have in fact worsened the situation. Whitehouse also raised concerns about the AHEAD program, a voluntary initiative meant to encourage innovative healthcare delivery. Rhode Island joined the program in good faith, hoping it could be a pathway to more balanced treatment. However, with Connecticut preparing to follow suit, Whitehouse fears Rhode Island could once again be shortchanged if the state's rates are locked in at lower levels than its neighbors. He criticized CMS for offering no assurances that this disparity will be addressed, leaving Rhode Island vulnerable to continued financial disadvantage. But the senator's testimony wasn't only about dollars and percentages. He pivoted to an issue that cuts far deeper on a personal level: end-of-life care. Whitehouse condemned current CMS rules that force families to endure unnecessary suffering. For instance, patients must often spend 3 days and 2 nights in a hospital before being allowed to transfer to a nursing home, a requirement he described as idiotic and cruel. He argued that forcing terminally ill patients and their families through bureaucratic hoops at such a sensitive time shows a complete lack of compassion. Whitehouse pushed for simple, humane reforms that Rhode Island is willing to pilot. These include allowing palliative care to be provided alongside curative treatment, permitting home-based care even if patients can still leave their homes, and expanding access to respite care at home rather than forcing hospital visits. He reminded CMS that similar waivers have been granted in other contexts, making it even more frustrating that Rhode Island's proposals remain stalled. What compounds Whitehouse's anger is the sheer lack of progress. He pointed out that he is now dealing with his 4th CMS director, yet the problems remain the same. He likened it to living through Groundhog Day, a cycle of repeated conversations and broken promises. While he acknowledged that some of these challenges predate the current leadership, he insisted that Rhode Island cannot wait any longer. The senator's demands were clear and urgent: fix the payment disparity, ensure fairness in the AHEAD program, and approve waivers that would allow Rhode Island to provide more compassionate end-of-life care. Without action, he warned, Rhode Island's healthcare system is teetering and at risk of collapse. Whitehouse concluded on a personal note, saying he was offering Rhode Island as a willing partner in reform and innovation. All he asked for was engagement from CMS leadership to finally put these long-standing issues to rest. For him, this is not about politics or policy paperwork. It is about hospitals struggling to stay afloat and families struggling to give their loved ones dignity in their final days. This isn't just about Rhode Island. It's about fairness, dignity, and the future of healthcare in America. Senator Whitehouse's call to CMS is a reminder that behind every policy failure are real hospitals, real doctors, and real families left struggling. The question now is whether Washington will finally act, or whether Rhode Island will continue to pay the price for a system that refuses to change. What do you think? Should CMS be held accountable for healthcare disparities between states? Let's talk about it in the comments.